We mentioned about Taiwan just being one of those success stories to battle COVID up until now. Tell us what you think went wrong here.
I think this time we come across a very highly infectious virus. That's the British variant. At the very beginning, the virus spread from this foreign country to get into Taiwan, and then it spread out in this adult entertainment venues in Wanhua district of Taipei City. And since this area, there's a lot of people gathering in the tea houses and without wearing face mask and without social distancing. So this, the outbreak surged quite rapidly. That's the reason why we announced this level 3 COVID-19 alert. And from May 15 to 28, and ask all the people to avoid unnecessary gathering. And also we closed the school and the kindergartens and so forth.
Sure.
And we try to contain the disease as soon as possible.
Professor Chen, can Taiwan go back to a COVID zero life? I take a look at economies like the US, where they're still getting 1,000+ cases a day, but yet they're easing mask mandates. And yet COVID haven economies like what we're seeing here in parts of Asia continue to have very strict restrictions despite getting just a handful of cases. Do you think that a COVID zero strategy is sustainable?
Yeah. I think that we are looking forward to contain this outbreak episode as soon as possible. And I myself consider that it may take 10 days or 2 weeks to control this outbreak. Since most of the cases we identified are all related to tea houses, and it is easy for us to do this containment. And more importantly, that we are doing very stringent cross-contact tracing, and all this cross-contact are mandatory to be home isolated for 14 days. And we consider through this kind of very stringent cross-contact tracing as well as this home quarantine, we are quite sure that we can contain this outbreak in the coming week. So we're confident on that. So we are hoping that we are going to return to this zero cases usual.
Professor Chen, what's complicating the issue and the fight is the mutation we're seeing, for instance, here in Singapore, the variant which started in India, which is more aggressive, which is also affecting the young people. Are you experiencing a similar problem in Taiwan? And how would you deal with such a situation?
Yes, you are totally right that for this time, the major variant is this British variant, B.1.1.7, and it is highly infectious disease with a large proportion of mild cases. But for these episodes of outbreak, this time, the majority of the infected people are the elderly. They go to this tea house in Wanhua district and also spread out the virus to their family members or their colleagues. So I think that we have a very good tracing of these cases. And for instance, in Wanhua district, we found that around 400 people, they are related, they are working in the tea houses or they are their clients. So I think this virus indeed is very, very infectious. But fortunately, we can detect it quickly. And also, we ask all these infected people to report their TOCC history honestly. It means that's travel history, occupation, contact history, and clustering history. And through this kind of TOCC history taking, we can identify close contact very well. And so far, we quarantined a huge number of this close contact of this confirmed cases. So and they try to limit it to the spread of the virus to other districts or other area. And we also consider
Taiwan,
that,
Taiwan will remain vulnerable until it ramps up its vaccination rate. Currently, it is still very low. Give us a sense of whether this can be done. How quickly are you securing your vaccine shots?
We already have purchased have the order of 20 million doses of vaccine, and our domestic vaccine manufacturer are going to provide 10 million doses. So in total, we are going to have more than 30 million doses of vaccine. And the first batch already arrived, but we are looking for another batch. Each batch was around 5 million from June to September. And we are quite confident that once we receive this vaccine, we will get this immunization program quite successfully. Dating back to 2009, that's an H1N1 vaccination program. And the flu vaccination program was successful. At that time, we vaccinated more than 300,000 people every day. So once we receive the vaccine, we are quite confident that we can have very good vaccine coverage within 4 to 5 months.
Professor Chen, you mentioned about how there's been a bit of difficulty when it comes to securing vaccines. The bottlenecks, of course, you have supply, you have logistics, you also have demand. Which of these three is the biggest issue for Taiwan now?
I think that so far the big issues is that we did purchase the vaccine, but the delivery are not on time, and we still are waiting for them. But we were assured that this vaccine will come in batch in June. And also, there's a good news that two domestic vaccine R&D and manufacturer company, they are doing clinical trial very well. And we hope that in June and July, they will get this emergency use authorization from Taiwan FDA. And they already have the capacity to produce 10,000 million doses of vaccine. And they are based on the spike protein subunit. It has much less side effects. So we are looking forward to this domestic vaccine as well. In addition to this, Moderna and AZ, we are going to have spike protein subunit vaccine. So we're really looking forward to a very successful coverage of COVID-19 immunization in Taiwan.
And Professor, I know you've made a lot of efforts in trying to push Taiwan when it comes to membership into the WHO. Do you think this latest outbreak can allow Taiwan to use this as a way to rally international support?
Yeah, I think that Taiwan is always try its best to help, and we are helping the world. And we also are willing to share our technology, our resources, as well as experience with the whole world. When we learned that there's a cluster of atypical pneumonia in Wuhan dating back to December 31st, 2019, and on that day, we sent this email to WHO and China CDC, trying to confirm the information. And on the same day, we started our epidemic prevention program already. But unfortunately, WHO did not consider that this kind of left no one behind as a principle. So I really urge that WHO should be focused on this professionalism and should keep on political neutrality. And Taiwan will help, and Taiwan is helping, and we would like to share our experience, technology, and resources with all the countries in the world. And we have applied for attendance of around 200 technical meetings held by World Health Organization. Unfortunately, we attend only 70 of them. It's around 30%. So it's really pity that even we do have good experience and knowledge to provide to the entire international community, but we did not get any possibility to help others. So we hope that in the coming future, we will be involved in WHO as well as in WHA. And recently, many countries, including more than 60 countries in the world, they already urged WHO to accept Taiwan as an observer member and also allow us to attend this World Health Assembly and all these technical meetings, and we are really looking forward to work with all these experts